Good afternoon. This is All India Radio, and I'm Tanvi Taneja, and with me is Prashant Kumar Sinha with the Midday News. The headlines. Centre assures doctors of their safety, saying all necessary arrangements will be put in place for their well-being. ICMR continues to scale up its testing facilities for COVID-19. Prime Minister Narendra Modi says people should pledge to work towards a cleaner, healthier and more prosperous planet. Ministry of Information and Broadcasting issues an advisory for journalists and media houses to take precautions for COVID-19. And over 3,000 students stranded in Kota to reach Madhya Pradesh today. Indian Medical Association today withdrew a proposed protest after a high-level meeting with Home Minister Amit Shah through video conferencing. Health and Family Welfare Minister Dr. Harshvardhan was also present on the occasion. Mr. Shah appreciated the role of doctors in general and particularly in the fight against coronavirus and expressed confidence that doctors would continue to work dedicatedly in this fight as they have been doing till now. He saluted the sacrifices made by doctors to keep people safe from diseases like COVID-19. Allaying all concerns of the medical fraternity regarding their security in the fight against coronavirus, the Home Minister assured them that Narendra Modi government would leave no stone unturned in ensuring their well-being and security. Mr. Shah condemned the recent attacks on health professionals and said that the Prime Minister is closely following all issues and concerns of doctors. He said all necessary arrangements would be put in place to prevent such incidents in future. He appealed to doctors not to do even a symbolic protest as proposed by them, as it is not in national or global interest. Considering the immediate high-level response from the government and assurance given by the Home and Health Ministries, the IMA has withdrawn the proposed protest to maintain the fight against COVID-19 in an uninterrupted manner. Indian Council of Medical Research ICMR has recommended the use of hydroxychloroquine for prophylaxis of novel coronavirus infection for high-risk population, including all asymptomatic healthcare workers involved in the care of suspected or confirmed cases of COVID-19. Nearly 5.11 lakh PPEs have been supplied to various states and central hospitals by the central government, which have added to the initial stock of 2.75 lakhs available with the state. The ministry has also supplied 30.32 lakh N95 masks to the states. Since there was no domestic manufacture of PPEs in the country, the Health Ministry, in collaboration with the Textiles Ministry, worked to encourage domestic production. More than 50 domestic manufacturers have cleared quality tests so far, and orders for nearly 1 crore PPEs have been placed with them. ICMR has tested 4,62,621 samples so far. 26,943 samples were tested yesterday by the various government and private laboratories in the country. ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 217 government laboratories and 87 private laboratories chains have been given approval to conduct the test for COVID-19. So far, ICMR has validated 34 real-time PCR kits for detection of COVID-19. A dedicated toll-free helpline number 08-046 11-0007 for providing psychosocial support for healthcare workers has been created. Guidance notes released by the Health Ministry has mandated timely payments for frontline workers such as ASHA.
The Indian Council of Medical Research ICMR has tested 4,62,621 samples so far. 26,943 samples were tested yesterday by the various government and private laboratories in the country. The ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 217 government laboratories and 87 private laboratories chains have been given approval to conduct the test for COVID-19. So far, the ICMR has validated 34 real-time PCR kits for detection of COVID-19. A total of 1,383 new confirmed cases of novel coronavirus have been reported in the country during the past 24 hours, taking the total number of cases to 19,984. Health and Family Welfare Ministry said that 3,870 patients have been cured so far. During the past 24 hours, 50 deaths have been reported, taking the nationwide toll to 640. Briefing media in New Delhi, Health Ministry spokesperson said the centre has issued detailed guidelines to all states that while focusing on COVID-19, all other services need to be provided, be it for dialysis, HIV, cancer and other treatments. The Health Ministry spokesperson also said the Indian Red Cross has started a round-the-clock control room for blood services in Delhi.
इंडियन रेड क्रॉस ने इसी संबंध में एक 24/7 कंट्रोल रूम ब्लड सर्विसेज के लिए दिल्ली में स्टार्ट किया है, जिसके फोन नंबर्स हैं 011-233-59379। दूसरा नंबर है 93-199-82104। एक और नंबर है 93-199-82105। इस फोन नंबर पर कोई भी संपर्क करते हुए अगर उन्हें ब्लड की नीड हो या उनको कोई ब्लड डोनेट करना चाहते हैं तो इस नंबर से कांटेक्ट करते हुए वह सर्विसेज हम ले सकते हैं.
The Home Ministry spokesperson gave details of assurances given by the West Bengal government to cooperate with the central government and inter-ministerial central teams.
पश्चिम बंगाल के सचिव ने पत्र लिखकर गृह मंत्रालय को बताया है कि उन्होंने टीम्स के साथ संपर्क किया है, बैठक की है और उनका ऑन द स्पॉट आंकलन में सहयोग दे रहे हैं. उन्होंने आश्वासन दिया है कि वे आपदा प्रबंधन अधिनियम के तहत पारित आदेश एवं माननीय सर्वोच्च न्यायालय के निर्देशों का पालन करेंगे. गृह मंत्रालय पश्चिम बंगाल सरकार के निर्णय का स्वागत करता है.
The Indian Council of Medical Research spokesperson informed that over 4.49 lakh tests for COVID-19 have been conducted so far in India. He said states have been advised not to use new rapid antibody tests for 2 days, adding that it will investigate issues of faulty kits.
The G20 Agriculture Ministers have decided to ensure the continuous flow of food and agricultural products to safeguard global food security and nutrition. An official statement following the Agriculture Ministers' virtual meeting yesterday said they commit to cooperating closely and taking concrete actions to safeguard global food security and nutrition. They reaffirmed the importance of working to ensure the continued flow of food, products and input essential for agricultural and food production across borders, in line with their leaders' statement on COVID-19 on March 26th. The ministers organized the meeting through video conferencing by the Saudi presidency, where they agreed to guard against any unjustified restrictive measures that could lead to excessive food price volatility in international markets and threaten the food security of large proportions of world population. Agriculture Minister Narendra Singh Tomar participated in the meeting of G20 Agriculture Ministers. He shared the decision of the Government of India to exempt all agriculture operations during lockdown period and ensuring continued availability of essential agriculture produce and supply. Union Minister for Petroleum and Natural Gas Dharmendra Pradhan interacted with over 1,000 LPG distributors from across the country through video conferencing yesterday. In the event, the minister lauded their good work in ensuring doorstep delivery of LPG cylinders during the lockdown. He also appealed to them to proactively reach out and maximize the delivery of 3 free LPG cylinders to Prime Minister's Ujjwala Yojana beneficiaries under the Pradhan Mantri Garib Kalyan Yojana announced for the poor to help them fight the battle against COVID-19 pandemic.
The government is taking necessary steps to ensure adequate supply of medicines, fertilizers and disinfectant chemicals in the country. Chemicals and Fertilizers Minister Mr. D.V. Sadanand Gowda held discussions with secretaries and other senior officers of the ministry to chalk out strategies to improve availability of fertilizers to farmers, medicines to the general public and health services and chemicals as disinfectants to curb the outbreak of the coronavirus. In a tweet, Mr. Gowda asked the officers to maintain close coordination within the ministry and other departments as well, so that supply of essential items are maintained without any hindrance. In our series Expert Speak, we bring you the views of leading medical experts on COVID-19. AIIMS Associate Professor Dr. Kaushik Sinha said all medical professionals who are on active COVID duty take very strong precautions to ensure that they do not get infected.
It has been seen that those who have or may have COVID-19 are being shamed publicly. When this disease does not discriminate, then why should we? Most of COVID-19 disease patients will get cured and return safely to their homes within 2 weeks. The individual discharged from healthcare facilities should be welcomed and not seen as a threat. In fact, they are one of our frontline warriors who have successfully defeated this disease. They are the ones who now have immunity against this disease. They are the ones who will play an important role in controlling this disease and prevent future epidemic through herd immunity. COVID-19 has taken lives, but let's not allow it to take away our humanity. Let's fight the disease and not the diseased. So stop stigmatizing and start empathizing.
Dr. Neeraj Nischal, Associate Professor at AIIMS, said people should not discriminate against COVID-19 patients, but instead help people in need.
Let us not shun the doctors. Let us help the medical healthcare professionals to beat this illness. And united, we will win.
I think it's important to understand that people who are working are actually the COVID warriors who are actually putting their life at stake and are therefore those individuals who need to be appreciated, cheered, and also be given more care by society rather than being stigmatized.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Dr. K. Srinath Reddy, President, Public Health Foundation of India, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. I repeat, 1800-115767. You can also ask questions on the telephone number 011-2331-4444. I repeat, 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on the FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website, newsonair.com, and on our YouTube channel, News on AIR Official. You can also follow us on the News on AIR app for regular updates. In an effort to guard against fake news being circulated on various platforms, we bring you a segment on fact-checking and myth-busters. Reports have appeared in a section of social media claiming that Ministry of Home Affairs guidelines for resumption of industries will lead to penal action against company directors and management. This is fake news. According to the Ministry of Home Affairs, it is wrong and incorrect. The provisions under Clause 21 of the guidelines is in nature of precautions for management of COVID-19. There is a misconception that coronavirus does not affect the young people and it affects those people who are 50 years and above. Dr. Nand Kumar from AIIMS refuted this claim, saying that at the age of 50, people's immune system gets weak and they start suffering from many diseases, hence they become more prone to the attack from any virus. Dr. Kumar said it is a misconception that coronavirus does not affect young people. He said if the immune system of a young person is weak, then he or she becomes prone to the virus attack as well. He said this is possible after coming in contact with the virus. Many young people remain asymptomatic, but still they can spread the virus like the people who are symptomatic. There are other reports on social media claiming that the government has launched beta version of Namaste app, a video conferencing alternative to Zoom. This is also fake news. According to the Ministry of Electronics and Information Technology, it is untrue, false and baseless. The government has not launched any such app. Citizens are requested not to pay heed to such misleading information and do not fall prey to it. Stay home, stay safe.
The Health and Family Welfare Minister, Dr. Harshvardhan, has launched an interactive platform, COVID India Seva, aimed at providing real-time solutions to COVID-19 related queries. People can post their queries to the COVID India Seva Twitter handle for getting swift replies from the team of trained experts. This initiative is aimed at enabling transparent e-governance delivery, especially in crisis situations like the ongoing COVID-19 pandemic. Dr. Vardhan said through this platform, trained experts will be able to share authoritative public health information swiftly to build a direct channel for communication with citizens. The responses by the experts will be available for everyone, and users will not be required to share any personal details or health records on this account. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Centre assures doctors of their safety, saying all necessary arrangements will be put in place for their well-being. The ICMR continues to scale up its testing facilities for COVID-19. Prime Minister Narendra Modi says people should pledge to work towards a cleaner, healthier and more prosperous planet. The Ministry of Information and Broadcasting issues an advisory for journalists and media houses to take precautions for COVID-19. Over 3,000 students stranded in Kota to reach Madhya Pradesh today. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
The Ministry of Information and Broadcasting issued an advisory to print and electronic media today, calling on journalists covering coronavirus-related incidents to take due precautions. The ministry said it has come to its notice that a large number of media persons have recently contracted COVID-19 while covering the happenings in certain parts of the country. The advisory asked the management of media houses to take necessary care of their field as well as office staff. During the ongoing lockdown, the West Bengal Postal Circle has served many people who are not the account holders of Postal Savings Scheme through its Aadhaar-enabled payment services. Under the service, a maximum amount of up to 10,000 rupees can be withdrawn in a day, provided the customer has a bank account. More from our Kolkata correspondent.
Many people are unable to go to bank to withdraw their salary, pension and money required for other purposes during the lockdown. The India Post has come forward to meet their demands through its Aadhaar-enabled payment services, said Chief Postmaster General of West Bengal Circle, Gautam Bhattacharjee.
AEPS or Aadhaar-enabled payment service that is offered by India Post Payments Bank through all the post offices. There is a post office almost in every cluster of villages. Banks are not so much in number, but not in such remote areas at the village level. In this lockdown period, people are facing difficulty, particularly in the rural areas, to go to bank and to withdraw cash from there. They can easily go to the nearby post office and can withdraw cash from that post office, which will be deducted from his bank account. The person concerned did not have any post office savings bank account or did not have any account in the India Post Payments Bank. It is possible only if that the bank account is Aadhaar linked. Then through biometric authentication, the post office can pay him the money that he desires to withdraw from his bank account.
Under the system, over 2 crores rupees have been disbursed from the post offices in the circle during last few days. Arijit Chakraborty, AIR News, Kolkata.
Over 3,000 students of Madhya Pradesh who were stranded in Rajasthan's Kota district are expected to return to the state by tonight. About 150 buses were flagged off from Gwalior yesterday for this purpose.
Total of 150 buses along with teams of medical, police and administration officials reached Kota yesterday. The buses will return to Madhya Pradesh today late in the night. Chief Minister Shivraj Singh Chauhan said that bringing back our students safely is the top priority of our government. More than 3,100 students of the state are studying in various coaching centers of Kota. Officials informed that screening of the students will be done in Kota also and again in the entry points of their respective districts. Social distancing norms will also be followed in these buses. Only one student will be in each seat. There would be police personnel, health personnel and people of administration in each of these buses so that appropriate safety is ensured. The buses having students of respective districts will directly go to their concerned district and district collector will then ensure that the children reach their home safely. These students will have to stay in the quarantine for 14 days after reaching their respective places. Sanjeev Sharma, AIR News, Bhopal.
In Rajasthan, the number of COVID-19 cases has gone up to 1,799. In all, 64 persons tested positive for corona today. A maximum of 44 persons tested positive in Ajmer, taking the total positive cases to 103 in the district. Our correspondent reports that of the total 667 cases have been reported from Jaipur alone. The administration is taking strict action against those who are not following the government's guidelines. A report.
The government has asked people to follow the lockdown with self-discipline. Action is being taken against those who are not following the lockdown guidelines. More than 7,000 people have been arrested for breaking the lockdown rules so far. About 94,000 vehicles have also been seized. Strict action is also being taken against persons involving in black marketing of food and essential commodities. Licenses of 288 ration dealers have been suspended after complaints of malpractices. Jitendra Dwivedi, AIR News, Jaipur.
In order to combat COVID-19, the Gram Panchayats in Himachal Pradesh have also come forward to stop the entry of any outsiders from within the state or outside. To keep an eye on the entry of any outsiders, the Gram Panchayats in the tribal district Kinnaur have deployed their people at the entrance of the villages.
Following the call of the state government, the Gram Panchayats in the state are keeping a close watch on people entering from outside the villages. Many Panchayats in Kinnaur district have guarded their entry points with barriers and deployed their people so that no outsider could enter their Panchayats from other districts and state. The Up-Pradhan Subhash Negi of Duni Panchayat of Kalpa Upmandal in Kinnaur district said that the entire region has been banned for the entry of outsiders. While the curfew has been imposed in the state to curtail the epidemic, the Gram Panchayats of the state are also doing their utmost to tackle this epidemic, which is a commendable step. With Sitaram Regi report from Kinnaur, this is Sanjeev Sundrayal, AIR News, Shimla.
In Uttarakhand, the spread of COVID-19 is under control. A total of 46 cases related to coronavirus have been reported so far in the state. The state government is monitoring the situation closely and all possible measures are being taken to prevent corona.
Total 46 cases of corona have been reported so far in the state, out of which 19 people have recovered completely. There are now 27 active cases related to corona in the state. The state government is taking all important measures to prevent corona and monitoring the situation closely. The date of opening the portals of the famous Badrinath shrine has been changed for the first time in the history, keeping in view of COVID-19. Portals of Badrinath will now be opened on 15th May, which were earlier to be opened on 30th April. Following the guidelines of the central government, imported industries have been given exemption in the state. The farmers of the state have also been allowed to harvest the rabi crop. They have also been asked to maintain social distance during the harvesting. Raghavesh Pandey, AIR News, Dehradun.
In Gujarat, the total number of positive cases reached up to 2,272, with 94 fresh cases reported since last evening. The maximum cases reported today are from Ahmedabad and Surat. 5 patients were discharged from the hospitals and 144 patients have been discharged. Ahmedabad Municipal Corporation has scaled up the testing facilities and is testing around 2,600 samples per million. A report from our correspondent.
Principal Secretary of Department of Health Dr. Jayanti Ravi said out of the total cases, 2,020 patients are stable while 13 are on ventilators. She said the death toll due to COVID-19 reached to 95 today. Out of the total cases in the state, 63% cases have been reported from Ahmedabad only. After targeting slums, Ahmedabad Municipal Corporation has now started testing of such as shopkeepers, vegetable vendors, garbage collectors to prevent the spread from even a single positive person. Curfew is remained in force in the walled city areas, which reported over 1,000 cases in the city. Over 6,000 persons have been quarantined in the city so far. The AMC will soon set up a 4,000-bedded COVID care center in the city. Aparna Khut, AIR News, Ahmedabad.
Manipur Chief Minister N. Biren Singh has said that the state now has no COVID-19 active case, as the second coronavirus patient was discharged from the hospital after he tested negative for the deadly virus. The Chief Minister said, though the state has no COVID-19 active case as of now, but people should keep vigil all the time. The Chief Minister also stressed on extra vigil along Indo-Myanmar border areas and directed DGP LM Khaute to reinforce police checkpoints at various areas, particularly those at Churachandpur district, as it is vulnerable. Manipur had 2 confirmed COVID-19 cases, but both the patients, a 23-year-old woman and a 65-year-old man, have recovered and have been discharged from the hospital. Goa was declared corona-free state a few days back. In Arunachal Pradesh, a retired Indian Air Force officer has taken up the task of preparing masks and personal protective equipment at a large scale at his Pazighat-based garment industry. Retired Group Captain Mohanto Panging Pao is passing his busy schedule in manufacturing face masks and PPEs in his Elam industry in East Siang district. He said he has taken the task as his moral responsibility. The Elam industry has already prepared and distributed about 50,000 masks and 1,000 PPEs, which are being used by the frontline warriors.
Kerala is on high alert as after a week's dip in COVID-19 cases, the state registered an increase of 19 new cases that were confirmed today. A report.
For the past 1 week, Kerala had been consistently reporting more number of recovered cases than new cases each day. But now, showing a change in the pattern, state confirmed 19 new COVID-19 cases, whereas 16 people recovered in a day. The state nodal officer, Dr. Arun Fettel, said that these numbers are not worrisome and the situation in the state clearly speaks that there is a decrease in the infection trend. State also reported certain different issues like many foreign returnees turning positive after 28 days of incubation period and many patients without any symptoms turning positive. And in yet another case, a patient continued to be positive even after 36 days. Considering all these unpredictable situations, the state had strengthened the health surveillance and decides to conduct wide testing. The lockdown measures had been strengthened in Kannur district that reported increasing number of cases lately. Presently, 117 active cases are there in the state. Mayusha for AR News, Thiruvananthapuram.
In Maharashtra, 553 new corona-positive cases were reported during the past 24 hours, taking the total number of positive cases to 5,229. Of these, 722 patients have recovered so far. 19 more deaths were recorded in the past 24 hours, as the total death count rose to 251, with a mortality rate of 4.80%. A total of 82,304 tests have been conducted so far in the state, of which 77,638 have tested negative for coronavirus infection. Meanwhile, State Health Minister Mr. Rajesh Tope, along with officers of the Inter-Ministerial Central Team IMCT Committee, visited Dharavi Transit Camp and the quarantine facility at Dharavi Sports Club this afternoon. More from our Mumbai correspondent.
The Mumbai civic body has issued circular asking medical teams to conduct house-to-house survey in slums to identify high-risk senior citizens, particularly those with medical conditions like diabetes, hypertension, chronic respiratory issues, asthma, kidney or liver disorder, and heart conditions. The teams will confirm if the person is on regular medication and check for oxygen saturation and accordingly refer them to non-COVID municipal hospitals. Though the G South ward in Mumbai tops the list of wards with the corona positive cases in city, a positive story coming out is 67 of the 487 cases have been cured, discharged and sent home. This particular ward had become a major cause of concern for the administration as over 3,500 persons from here were in institutional quarantine. The area that comes under G South ward are Varli, Prabhadevi and Lower Parel. These areas are dotted with Mumbai's many of the oldest chawls and almost 80% cases were reported from the semi-slum and slum areas. Sonali Ghadar Patel, AIR News, Mumbai.
Vice President M. Venkaiah Naidu has called upon people to renew commitment to shape collective future on this planet by preserving and replenishing Earth's valuable resources. Prime Minister Narendra Modi has also expressed gratitude towards the planet for the abundance of care and compassion on the occasion of Earth Day today. In a tweet, Mr. Modi said people should pledge to work towards a cleaner, healthier and more prosperous planet. He also lauded all those working at the forefront to defeat COVID-19. Environment Minister Prakash Javadekar has also urged people to pledge to shed greed and adopt sustainable lifestyle on the occasion of Earth Day. Sharing a video on Twitter, Mr. Javadekar said,
"For Indian lifestyle, which is completely environmental friendly, is an example of how we can move ahead. Some people argue that if we cut on our consumption, the economy will suffer. But it won't, because if you are cutting on certain kind of consumption, you will be doing other consumption, which is of more necessity, which gives equity, which gives justice."
The minister recalled Mahatma Gandhi's words that the world has enough for everyone's need, but not for everyone's greed. In the United States, Missouri has become the first state to sue China, alleging that Beijing suppressed information and denied the contagious nature of the novel coronavirus. The lawsuit alleges that during the critical weeks of the initial outbreak, the Chinese authorities deceived the public, suppressed crucial information, arrested whistleblowers, and destroyed critical medical research. And now, before we end the bulletin, here are the headlines once again. Centre assures doctors of their safety, saying All necessary arrangements will be put in place for their well-being. ICMR continues to scale up its testing facilities for COVID-19. Prime Minister says people should pledge to work towards a cleaner, healthier and more prosperous planet. Ministry of Information and Broadcasting issues an advisory for journalists and media houses to take precautions for COVID-19. And over 3,000 students stranded in Kota to reach Madhya Pradesh today. And with that, we end the midday news.